Blood pressure is measured in millimeters of mercury and shows how much force your blood puts on your artery walls. The top number represents the systolic pressure when your heart beats, while the bottom number represents the diastolic pressure between each heartbeat. To get these measurements, you can manually check your blood pressure with an arm cuff, balloon, and stethoscope, or you can use an automated blood pressure machine with an arm cuff attached. In either case, avoid alcohol, caffeine, food, or exercise for at least 30 minutes before your reading. The best time to take it is once in the morning and once in the evening when you're most relaxed. To start, sit quietly for 5 minutes at a table with both feet firmly on the ground and your legs uncrossed. Your back should be supported and your arms should rest on the table in front of you. If you're using a blood pressure machine, press the power button and wait for the monitor to turn on. Roll up a sleeve and attach the cuff to your arm. Press the button on the machine again to start inflation, and try not to move or talk during this process. When your blood pressure reading appears on the screen, write the numbers down and sit still for 1 minute before repeating this process. Write down the second set of numbers, then average the two readings for your final result. If you are manually checking your blood pressure, start by locating your pulse with your index and middle fingers or a stethoscope on the inside of your elbow. Once your arm cuff is secure, inflate the cuff until your pulse disappears. Then pump it about 30 millimeters of mercury higher. Slowly deflate the cuff until you first hear your pulse, and take note of the reading as your systolic pressure. When the sound of your pulse stops, record your diastolic pressure. Repeat this process for a second time, and then take the average of both sets. If your systolic pressure is 130 or higher, or if your diastolic pressure is 80 or higher, wait 5 minutes and retest. If this pattern continues or you notice any troubling symptoms like dizziness or chest pain, talk to your healthcare provider right away.